Good morning, everyone. My name is Imran Hosen, and today I am here to present our research title, Forecasting Wiring of in Parkinson Disease and Ensemble Learning Approach Using Wearable Data. Parkinson disease, a neurodegenerative disorder, affects millions worldwide. As the disease progresses, many patients experience the wiring of phenomenon, where symptoms re-emerge between doses of medication. This can severely impact their quality of life, making it crucial to accurately predict when these periods will occur. Our study focus on leveraging wearable technology and ensembling machine learning techniques to predict this wiring of episodes. In this presentation, we will first explore the background of the Parkinson disease and the wiring of phenomenon, followed by the problem we are addressing with current prediction methods. I will discuss the novel contribution of our study, particularly our ensemble learning approach and how wearable data is utilized. Next, I will dive into the methodology, including data preprocessing and model development. We will also examine the result of our experiment, including the performance of both machine learning and deep learning models. Finally, I will conclude with the broader implication of our findings and future research direction. Parkinson's disease is characterized by both motor and non-motor symptoms, such as tremors, rigidity, and cognitive decline, all of which progressively worsen over time. Levodopa, the standard treatment for the Parkinson's disease, becomes less effective as the disease progresses, leading to a phenomenon known as wiring off. Patient experience a return of symptoms before their next dose, making it difficult to manage the disease. This unpredictability not only affects their daily activities, but also complicates treatment planning. Accurate prediction of wiring of periods can help tailor medication schedules more effectively, improving the patient overall well-being. While previous studies have explored using wearable devices to predict wiring off in PD patients, they often face significant limitations. For example, models developed by Khatamino et al. And Shah were either tested in controlled environments or exhibited lower accuracy. Additionally, controlling a high-quality real-world dataset has proven to be a challenge. Our goal is to overcome this obstacle by developing a model that works effectively with commercially available wearables, can be applied in real-world conditions, and achieve higher prediction accuracy. Our research introduced several key innovations. First, we employ commercially available wearable devices such as Garmin, which record a variety of health metrics, including heart rate, step count, and sleep quality. These metrics provide valuable insight into the progression of Parkinson's disease. Second, we utilize an ensemble learning approach that combines multiple machine learning models, including a random forest, support vector classifier, and exhibit classifier, to predict wiring of episodes. By leveraging the strength of each algorithm, we achieve a more accurate and robust prediction model. Our data-driven method not only improves prediction accurately, but also enables personalized treatment strategies, offering a tailored approach to each patient needs. Our methodology consists of two major components, data preprocessing and model selection. The dataset used in this study was collected from 10 participants and contains three primary types of data: heart rate and activity data from Garmin wearables, self-reported wiring of periods via the wiring of questionnaire, and drug intake information. We structured the data into both 15-second and 15 minutes intervals, ensuring that the time-specific features like heart rate and step count align accurately with the predicted wiring of periods. For model selection, we implemented both traditional machine learning algorithm such as random forest, support vector classifier, and XGB classifier, and deep learning model including convolutional neural networks and long short-term memory. The ensemble learning approach aggregate prediction from multiple classifier, allowing us to build a more resilient model that can adapt to the complex nonlinear patterns. The dataset obtained from Victorina et al. In 2023 was divided into three parts: garment data, wiring of periods, and drug intake. The garment data tracked various physical measurements such as heart rate, stress level, and sleep patterns. The wiring of period were also self-reported by patient using the wiring of questionnaire. Finally, drug intake information was logged by the patient, providing insight into how medication schedules might correlate with the wiring of events. In pre-processing, we applied techniques like normalization and feature engineering. For instance, we created new features by aggregating the data over specific time intervals, which helped capture trends leading up to wiring of events. We split the data into 70% training and 30% test set to evaluate model performance. The diagram here illustrates the architecture of our proposed model. At the heart of our approach is ensemble learning, which combines multiple machine learning models using voting classifiers. By leveraging random forest, support vector machines, and XGB classifier, we are able to achieve a high level of accuracy in predicting wiring of periods. Each model contributes to the final prediction, with the voting mechanism determining the most likely outcome. In addition to the machine learning models, we explored deep learning models like CNN and LSTM, but this exhibited slightly lower performance due to limited size of the dataset. Our results show that the XGB classifier outperformed of the other machine learning models, achieving the highest accuracy, followed closely by the random forest. The support vector classifier performs slightly worse, especially in the participant data where wiring of patterns are less clear. However, the ensemble learning approach improved overall performance, especially in terms of recall, as it could effectively handle different data distribution across participants. When compared to the deep learning model like CNN and LSTM, we observed that machine learning model had better accuracy, particularly for predicting non-wiring of periods. For instance, in participant data, XGB classifier and random forest achieved around 90% accuracy, while CNN and LSTM were closer to 85%. This classification report presents a more detailed view of how our ensemble model performs across different participants. We saw variability in both precision and recall, particularly for the class representing wiring of events. The ensemble model had high precision for detecting when wiring of did not occur, but recall was lower when detecting actual wiring of events. This indicate that while the model was good at predicting stable periods, predicting actual wiring of remains a challenge, especially for some participant. This is likely due to the limited number of training example for wiring of events, a common issue in medical dataset. To conclude, we successfully developed an ensemble learning model that accurately predict wiring of periods in Parkinson disease patient, achieving an overall accuracy of 93.2%. Our model demonstrated robust performance across different participants, showing promise for real-world clinical application. However, deep learning models like CNN and LSTM showed lower accuracy, likely due to the small dataset size. In future research, we aim to involve a large group of participants to improve model generalization. We also plan to enhance the deep learning models, which holds potential for better performance as larger dataset become available. Furthermore, we envision this approach being integrated into real-time patient monitoring systems, providing clinical with the tools they need to offer more personalized and responsive care. Thank you for your attention. I'm happy to take any question.